So good morning. It's great to be here at Moderna's Norwood facility. The first time the Lieutenant Governor and I became familiar with this site was actually several years ago when Mass Life Science Center issued a series of awards to biotech manufacturers here in the Commonwealth, one of which was the nascent development that was going on this site and in that Polaroid building. And who knew at that time that this particular site would become the epicenter of the most significant and important battle waged against a global pandemic here in the United States. Now more than ever, we are enormously proud to be able to call Moderna a Massachusetts-based company. In addition to this facility that they have here in Norwood and the expansion that's going to take place here, they also have an operation in Cambridge. And there are many, many people who live and work here in the Commonwealth of Mass who have been part of this enormous success. It goes without saying, we are all so grateful for the innovation that happens here at Moderna. And the fact that on a very complicated and difficult task with very short time frames, this company delivered, not just for the people of the Commonwealth, but for people all over the world, in just a matter of months. And I said earlier when we were inside that the first time I heard Moderna mentioned in the context of the COVID pandemic was in March of 2020, and I know exactly where I was. It was nighttime, I was in an automobile, and I was right around Suffolk Downs, and I was talking to a former federal official who did a lot of work in biotech and research who said to me, you know, there's a company in Massachusetts, Moderna, which I was familiar with, that's working on this mRNA platform, and you know, who knows what will happen, but they could be one of the first companies to actually deliver a vaccine. And you didn't just deliver one, you folks delivered millions and ultimately what will be billions of vaccines that will serve people all over the globe as this battle against the pandemic continues. And before I talk a little more about Moderna and about our vaccine efforts, I do want to give a quick update on COVID. Yesterday, the Department of Public Health reported 472 new COVID-19 cases out of about 42,000 tests. We're now over 22 million tests administered here in the Commonwealth of Massachusetts, and we remain a national leader when it comes to COVID-19 testing. And even as more and more people have gotten vaccinated, testing remains a critical surveillance tool to keep the virus in check as we go forward, and we thank people for continuing to get tested. Our Stop the Spread free testing program currently provides over 35 different locations across the Commonwealth, most of which are targeted to communities where we have seen significant COVID in the past, and they are open and available to everyone. Stop the Spread's been a crucial part of the Commonwealth's testing success. More than 2.3 million tests have been conducted as part of that program alone. We're pleased to announce today that we'll continue to extend the Stop the Spread program through the end of September because it remains an important tool in the battle against COVID. With respect to the rest of the public health statistics, the 7-day average of positivity on our COVID tests is now at 1.32%. That's obviously down to a percentage that's pretty familiar with what we saw back in the early part of last fall. 441 people are in the hospital with COVID and 117 are in the ICU. We also crossed a big milestone yesterday. 3 million people in Massachusetts are now fully vaccinated. That's another big step in our efforts to get vaccines into as large a portion of our population as we possibly can so that we can get back to normal. We're enormously grateful to everybody who's been part of this process, to the healthcare workers, the vaccine providers, and the other partners who have worked so hard for the past several months to make this milestone possible. We remain one of the top performers in the country when it comes to administer vaccines, with nearly 74% of adults having received at least one dose, and we're one of only 5 states in the country that has crossed that 70% milestone. This week, we're distributing more vaccines to providers across Massachusetts. We've been allocated by the Fed program about 245,000 first and second doses. About 82,000 doses are being allocated to hospitals and healthcare providers, About 57,000 doses are going to regional collaboratives. Mass vaccination locations are receiving over 97,000 doses. And in addition to the state allocations, the federal government's allocating over 112,000 doses directly to its retail pharmacy program, which I think, as most people know, we're about 50 pharmacies in Massachusetts in February, and there's now, I think, over 800. 863. We're also getting ready to begin vaccinating 12 to 15-year-olds. On Monday, the FDA authorized the use of Pfizer vaccine for this age group, and today the Advisory Committee on Immunization Practices will meet and make a recommendation on this approval. This group represents about 400,000 individuals here in the Commonwealth, and we're working with our providers and our mass vaccination sites and others to put plans in place to vaccinate this group once we receive word of a final approval. The Department of Public Health has already reached out to the primary care community and to the pediatric provider community in order to discuss with them a process for ensuring that they're part of administering the Pfizer vaccine throughout their practices once the vaccine is approved for this age group. And if parents have questions about the vaccines for their kids, they should contact their primary care provider or their kid's pediatrician for more information. Pending the CDC's approval for this group, people aged 12 to 15 will be able to book appointments or access a walk-up appointment beginning on Thursday, May 13th. We're also pleased that Moderna is moving forward with federal officials on the approval of their vaccine for people under the age of 18. We applaud their progress and look forward to Moderna's vaccine working their way through this important and rigorous approval process as well. More is the better here. We remain a national leader with respect to vaccine distribution. We're on track to hit our goal of vaccinating over 4 million people by early June. And now that we've made so much progress by having almost 75% of our population, adult population, with one dose, we're pivoting our operations to continue to expand the ground game and break down barriers in every zip code. We have a lot of work to do to reach more people, especially in some of our hardest hit communities. And as part of this operation, I'm pleased to announce that our administration will soon launch an employer vaccination program. This program will provide options for the Commonwealth's employers to book appointment blocks for their employees at the state's 7 mass vaccination sites or to request mobile vaccine clinics to arrive on site at their location at a scheduled time. The program is intended to provide 2 great options for employers of all sizes, and is another way we're working to build out vaccine administration to get more people dosed safely and conveniently. The vaccine is free to everyone, and it remains the best way for folks to protect themselves, their loved ones, their neighbors, and their co-workers. More details will be provided on this program very soon, so stay tuned. And as we create more ways to access vaccine, it's always worth remembering the incredible progress that has been made in such an amazingly short period of time. A year ago, we were preparing to launch phase 1 of our reopening plan, taking cautious first steps toward reopening our economy with very strict protocols in place. Our healthcare system was under tremendous pressure, and here we are, just a year later, and things look very different. Much of our economy has reopened. Our students are returning to their classrooms. Cases and hospitalizations are dropping, and all of the public health metrics continue to move in the right direction. This progress has been made possible thanks to the incredible speed at which scientists developed a life-saving vaccine and the partnership so many have had with organizations like Moderna and so many of the healthcare folks who've been working to get people vaccinated through our program of vaccination sites. Scores of researchers and employees here at Moderna worked around the clock, literally around the clock, many of them sleeping here day after day after day, to complete their work to prove that this vaccine was safe and effective. They relied on existing research and innovation with respect to the mRNA vaccine technology, and they were prepared to work with the federal government on a speedy approval process. This enabled them to achieve their goal in an absolutely record period of time. They were there at the very beginning as we started to vaccinate our healthcare workers in December, and they've played a vital role in our vaccine infrastructure, with over 2.8 million doses administered, or 41% of all doses administered here in the Commonwealth. And the vaccine, by the way, my wife was actually a Moderna recipient, and it's been proven to be highly effective at saving lives, keeping people out of the hospital, and reducing the spread of COVID. I just want to say finally, on behalf of all of us, we're very proud that Moderna calls Massachusetts home, and so many of the people who are part of this team are also from Massachusetts. And most importantly of all, Moderna is going to continue to expand their footprint here in Norwood as they continue to grow their vaccine footprint so that they can continue to manufacture and distribute the vaccines that are so critical to getting us out, not just here in Massachusetts, but across the country and around the world, from under the grip of this awful and terrible and brutal pandemic. Thanks very much.